Well, welcome everyone. Again, my name's Anthony Nappy. I'm the nurse liaison for the Project Virginia Impact out of UVA School of Medicine, and our focus really is improving patients' access to and coordination of care, specifically through telehealth optimization. And so we are proud to work with Mountain Empire Older Citizens. I was telling Kathy just a couple minutes ago, I was cold this morning walking my dog until Michael told me that parts of Southwest Virginia got 5 inches of snow. So now I feel relatively warm. So thank you, Michael, for that. But we are today here to start our training as we walk with Mountain Empire Older Citizens through the implementation of telehealth, and we'll start with really kind of the front end of the training in general telehealth etiquette and best practices. And we have Kathy Wibberly, who's the director of the Mid-Atlantic Telehealth Resource Center, who will present for us today. And as we move forward, if folks can just put their name and role in the chat for me for record keeping, and just for in the instance that there's someone I have not met yet, that would be great. And we'll get started right away here. So thank you, Kathy. Appreciate it.
All right, thanks all. And you can see my PowerPoint. I take it.
There we go. Yep.
All right, great. So we are going to do a whirlwind tour of telehealth best practices. I'm not going to cover every single thing, but I think most of the getting started stuff that you need to know. Anthony tells me that you all have worked on workflow and have done all of that already, so I'm not going to spend much time on this other than really thinking about workflow from both the provider and the patient experience. So as you get started, make sure you get some patient input as well as your staff input to optimize that. And patient satisfaction is usually high if they can connect, and so that usually solves that problem. The staff satisfaction is not always high. And so really make sure that once you get this started, that you talk to your staff and go, hey, what could have been better for you for this? I suspect that you've worked hard on this already, so you should be fine, but always ask. At minimum, in terms of workflow, think through the following, like how will my patients be informed about the availability of telehealth services? There's always better ways to do it. And so really be thinking about that. How will the patient be prepared, and who will prepare the patient? So there's always better ways to do that as well. How will telehealth visits be scheduled? Who'll do the scheduling? What happens when there are technology or equipment problems or other issues? And what happens at the end of the visit? That's often the thing that people don't think through. Like you sign off, and then you're like, all right, who's going to follow up with whom? And, is there a prescription involved? And how's that patient going to, get that prescription filled? So kind of thinking through all of those, or, does there need to be another appointment scheduled? If so, how's that going to work? So really think through that so that the communication happens at the end of a visit as well. Also, I also wanted to mention that, oftentimes when the patient's like in your office or in your setting in the clinic, you walk them out to kind of a checkout or a receptionist desk to check out. And so there's like when you get the prescriptions filled, and when like you can do that by video as well, but you need to kind of coordinate that. So you need to plan like, okay, this patient's going to need another appointment. So let's then ping so-and-so to join the video call at the very end. And it could just be simple as text messaging the person who's going to be scheduling and say, this patient needs an appointment. Can you join us in 5 minutes? But those are things that people often don't think through. So I'm going to spend the bulk of our time on operational best practices. And these are really kind of the administrative pieces in terms of developing your protocols, policies, and procedures around some key things. So with a telehealth visit, one of the first things you do is when the patient joins is verify identity. Now for you all, know your patients. Some of them have known for years. So if they're on video and you see them and you recognize them, that's fine. But you might get someone who's brand new, or you might have a provider who's new who does not recognize all their patients and may or may not, know their visual. But you may also have someone who joins you by a phone call. and you might not have an idea of, am I talking to the right person if you don't recognize their voice? So have some protocols in place for how you verify. Now, if they're on video and you don't know them real well, maybe it's someone who's just shown up once and you kind of know their name, but you don't know them by face. You could ask them um, to just show their, a picture ID next to their video. Can you hold up your driver's license or whatever next to you, just so I can verify that I'm talking to the right person. If you have their chart in front of you, you could ask, could I just have you verify your birth date? Some simple ways that to confirm that you know who they are and they know who you are. We also say that you should confirm who you are if it's not someone that they know real well. So let's say you have a new provider, they've not worked with this patient before, and they have no idea who they're talking to. It's always a good idea to say, hey, I am, Dr. So-and-so, or I am nurse so-and-so. Um, I always say if you're in your office and you have your credentials, like your certificate and your background, like go ahead and just like move your camera and show, here are my credentials. Or you can show your ID, or you can say, here's my Board of Medicine, license lookup, and you can look me up if you need to. But there are different ways that help kind of inspire some confidence that they are talking to a legit person. There are lots of scams out there, especially for older adults. Someone could text them and go, hey, I'm a provider. You have an appointment now. And they have no idea if it's you or if it's some random scam person trying to get their information. So always a good idea to verify identity. All right, another thing that you want to do when you start a visit is jurisdiction. So where are you located today, Mrs. Jones? We often assume that people are at home, and they probably are, but you never know. And so it could be that Mrs. Jones has moved to their daughter's house or is gone to visit a friend, and now they're needing a visit. That daughter may live across the state boundaries, and so that is one of the reasons why we need to check jurisdiction. Virginia and almost all states' law says that you have to be licensed in the place, in the location where the patient is physically located at the time of service. So if Mrs. Jones just went to visit daughter-in-law in Tennessee and you don't have a Tennessee license, you are sadly going to have to say, I am sorry, but I can't do a telehealth visit. I'm happy to consult with you on some things, but we can't have a medical visit where I'm actually diagnosing or assessing your condition because I'm not licensed in Tennessee. Now, some of you may be, and that's great. If you are, fantastic. We've also had interesting um, use cases where patients are traveling in cars while they're doing their visit. We don't encourage that. We ask you to, tell your patients, and this is part of the preparing patients in advance thing, to not be in a moving vehicle that affects your internet connection. But you also then can't verify location because they could be crossing state boundaries in the middle of your visit. So those are just things to protect you. Now, if the patient's at home, you have their home address in the medical record, that's great. You can just say, hey, Mrs. Smith, just confirming, are you at home right now? And if they say yes, and you recognize their home setting, that's great. You can move on. If you don't recognize their home setting, you could say, and let me verify that your address is, 1703, Lindcrest Road. And they'll say yes. Okay, great. Why do we want to do that? In addition to kind of the licensure issue, we also want to do that because of an emergency. You really want to know if I need to call an emergency service, emergency medical service. You as a provider, if you dial 911, that 911 is going to connect to your emergency dispatch where you're located. So if the patient is not located where you're located, you probably need to call a different emergency number, and we'll get to that in a second. But that is also why you want to verify jurisdiction. Informed consent. So informed consent is generally not required for a telehealth visit, but it's a best practice. It may be required for certain payers. So if you are billing, whether it's Medicare or Medicaid, really understanding what their requirements are. A best practice is always to make sure that the patient has some kind of informed consent documented. So it could be that, when a patient signs up for the PACE program or when they become part of your organization or participate in your activities, you have a whole set of forms that they sign, and that could be included in that. And we offer telehealth visits, and if you sign here, um, informed consent does not have to be signed in Virginia. It could be verbal. And so one of the things that you could do is, and I recommend, is that you have a little bit of a script so that it's standardized. You date it. So this is our informed consent script. You know, when we start a visit, we'll say like, these are the issues with potential concerns with technology, that it could fail and we might have to, you know, not do a video visit. It could be, you know, there could be potentially some hacking. We try to do everything we can to protect, you know, your information. Um, there could be, you know, if you're using a provider who's, let's say, under supervision, you really want to kind of say, and the supervisor is going to be, you know, potentially watching this video. We don't recommend recording video visits. One, it's a liability issue if you have a recording, because if something goes wrong and a lawyer subpoenas your video, they could cut and paste portions of the video that could make you look really bad. And so we really just say, for your protection, don't record your visits. Talking about emergency procedures is also part of informed consent, but also talking about communication failures. You know, if the video goes down, what's the next protocol? So kind of helping them know like what the processes are. If you have that written down in your script, then all you have to do in the patient chart is just say like, use the script for informed consent, date your script so that if you update it, you know which version you used, and then just save each version. So use script dated 11/23, patient consented. That's all you really need to do. Now you have a backup. The script that we used was here. I can pull up that file if anyone needs to verify. All right, so we want to talk about emergencies, and this is one of the things that I like to spend a little bit of time on. Because as I mentioned, if you call 911, if the patient is having a medical emergency or even a mental health emergency, 911 goes to dispatch where you're located as a provider. So let's say you're seeing the patient from the center or from your home. You could be living in the next town over from the patient. You could be several, you know, the next county over from your patient. And so your 911 dispatch may not be the right one to be calling. So we always say, have in the patient chart or in the patient record the emergency and non-emergency number for where the patient's home is or where they're typically located at the place of service. That could be as simple as just doing a Google search, you know, Russell County emergency and non-emergency numbers. Have that located so that if, you know, you're talking to the patient and they're having shortness of breath and they're dizzy or they're showing some signs of a stroke, you can immediately pull up the emergency number for that location and call and say, I need, you know, EMS dispatch to this location. They're having a medical emergency. Similarly, if you have a mental health emergency, you know, you're talking to the patient and you find out that they've taken a bunch of pills, they're suicidal, or maybe they have a fall, and you need to get 911, but you can't call 911 because they're not in your location. So that's really very useful to have. So just note that in the record. We also say that you should have a non-emergency number in case you need to do, let's say, a check on that patient. But the next slide, I'm going to say that we also ask that you have a patient support person. So what does that mean? Usually when you do an intake with a patient, you ask for an emergency contact, but patients don't have to put an emergency contact that is in their vicinity or who can reach them quickly. Oftentimes that emergency contact is a relative that could be, you know, a couple states away or in another jurisdiction. And so they can't reach that patient very quickly if someone needs to do a welfare check, for example. And so what we ask is a patient support person, which could be a very different person than the emergency contact. It could be the same person if that emergency contact lives in their same town. So this could be a family member, a caregiver, an adult within the home, but it also could be a neighbor or a friend who lives close by. It's someone who can be contacted to assist. If there's an emergency, but it's not a rush the EMS to the emergency, but more of a welfare check emergency. So let's say this person has communicated to you that they've been really depressed and it's been hard to get out of bed. They're not suicidal. You've done some risk assessment, but now they've missed their appointment and you're calling their phone number and they're not picking up the phone. This is in a situation where you might want to call that patient support person and say, hey, I'm a little bit concerned. So-and-so has, said that they're a little depressed. They're having a hard time getting out of bed. They were supposed to have an appointment today and they're not answering their phone. Would it be possible to go over there and just check on this patient? It's oftentimes better than calling law enforcement because law enforcement can be traumatizing for patients, especially if they've had a negative experience with law enforcement in the past. So it's so much better for there to be a patient support person who can just knock on the door and go, hey, um, we heard that you missed your appointment and you were having some issues. Would love to just check on you, make sure you're okay. That patient support person does not need to be in the home, does not need to participate in the session, does not even need to know that you have an appointment. It's just someone that you can call just in case. Now, if you need to use the non-emergency number because you do have some concerns, it's not necessarily an emergency, you can call that non-emergency number for law enforcement and have someone check on that patient. So those are your alternatives for an emergency situation. All right, security and privacy is another thing where we really recommend you have some good policies and protocols around. One thing that we like to say right up front is that, hey, I'm not going to record this session, and I'm asking that you not record this session unless we have express permission from each other. Because on a call, you don't know. A patient could be using their phone and they could be doing a screen capture. Um, they could have another recording device. And so being able to just say that up front is good, but it also reassures the patient that you're not recording. Now, if you are recording because for training purposes or for supervision purposes, you do want to say that to your patient. I am a trainee and my supervisor will be viewing this video for supervision purposes. As soon as that's done, we're going to destroy this. Do I have your permission? That's always important. In terms of privacy, um, always ask if there's someone else in the room and document it in the notes if there is, because you don't know. Especially on a video visit, there could be 10 people sitting in the background and you can't tell. They could have a Zoom background in their video. Um, but it also has to do with your confidentiality in terms of talking with your patient. Because there are situations where there might be elder abuse, there might be abuse in the home. And if the abuser is sitting in the background and you don't know that, you may be saying things that could jeopardize your patient, but they also may be not at liberty to speak freely to you, but you don't know that. So you may be asking them some really, important questions and they're giving you bogus answers because there's somebody in the room. So always just say, is there someone in the room with you right now? And they can nod, they can, however you want to do that. If they're obviously not in a private place and you're seeing people walk back and forth in the background, that's another place where you might say, is there a private place where you might be able to, move to where there's no interruptions? Now, ideally, you've already prepped your patient and you've already told them, like, hey, when we're going to have a visit, it would be great to have a private location. For some patients, that could literally mean like sitting in the car in their garage. We've had patients sit in the bathroom. There are some houses where there's just no privacy. And now I'm also going to talk culturally. There are some cultures where they want to have all the family members involved. Latino cultures are often like that. So when they come to an in-person visit, they've brought 3 or 4 family members with them. And they say, yeah, well, just come into the office with me. We'll have these conversations. If that is the case, just document that. daughter-in-law and sister-in-law were in the room, patient consented and said it was okay, and they wanted those people to be in the room, but just document that in the record. So those are some things. Now, on the provider end, you also want to disclose if there's someone else in the room with you, because the patient may not know. If they're in the in-office visit, they know if there's a nurse or a scribe or whoever in the room. They won't know on a video visit. So you want to say, you know, good to see you today. We're having this appointment, and I just want to let you know that I have a scribe listening in the back, who's taking notes for me. Or I'm just want to let you know that my nurse is sitting next to me, or if you are the nurse, I have a clinician sitting, in earshot in case I need to call them. Those are all good things to disclose, and it models for your patient how you want to communicate in terms of privacy and security. So another best practice, and I talked about potential unsafe situations in the home. If you have a client or patient who might be in, let's say, an elder abuse situation or a family violence situation, domestic violence situation, or it could be a child abuse situation. They might have a grandchild and you suspect that there's some abuse going on in the home somewhere. You want to pick up the phone before your visit and just say, hey, I know that there are some sensitive things on in your home. Let's figure out kind of a way to make sure that you're safe. And so what we recommend is establishing a safe word or phrase that you have with that patient. So if someone walks in that house, if they don't feel safe to talk to you, if they shut off the camera and you don't know what's going on, um, that you have this document in the notes. And it's always a good idea to have the patient come up with that safe word or phrase, because then they will remember it. So it could be like, hey, let's come up with a safe word. Maybe it's your favorite color or your favorite fruit. Or maybe let's come up with a phrase. So I might start every visit asking a question, a simple question like, hey, did you go to Walmart today? And the answer, would be, yes, I went, and it was great. That could be like everything is safe. No, I didn't. I need to get there. That could mean, things are not safe right now. I'm not in a private space and I can't talk freely. So think through that with your patient, and then you can, if it's not something that you would do every visit, but like someone could walk in the house, then they could just have that safe word. It could be simple like banana. And so they could say, hey, I need to go get bananas. And that means I'm not safe right now. I can't talk right now. Let's just talk about safe things. Or let's reschedule this visit. So that's always a good security and policy procedure that you might want to have. Now, I'm not going to spend much time on HIPAA because I know that you all have been working on the technology and probably have some things in place. And if you don't, Mike Patterson and his team can work with you on those things. But just wanted to say that, we do need to have some things generally in writing about your security, privacy, all of those policies and procedures. And HIPAA is not just technology, so it has to do with your administrative controls, your physical controls. So those things can change if your provider is working from home or if you're versus the office. And so, are you on a private virtual network when you're connecting from home? Do you have, a screen lock on your computer or laptop if your family members are using a shared laptop? Do you have, a sign on your door that says patient visit in process, do not enter? Do you have, if you bring paper files home with you because you're having a visit, do you have a locked cabinet for that? So all of that has to do with HIPAA as well. It's not just the video. And I'm sure that most of you know that and have been trained on that, but I just wanted to reiterate that. So some other things to have some protocols and policies around are tech troubleshooting and backup communications. So you really should have that policy that you described to your patient. And this is one thing that I actually recommend giving out on paper. So if we have tech trouble, here is what you would do. Because if you have tech trouble, it might also mean that they can't access the internet for whatever reason. It could be their internet's down. And so then they can't access a document that's in their email, or I can't access something that's on your website. And so, give them a piece of paper. Here's our video visit. Here's what happens if you have tech problems. Here's who you would call. One thing that we recommend is if the provider is working from home, you may or may not want to give out your home number. But if you're having a visit from home, who's that patient going to call if something goes down? So you might say, I'm going to call you. That would be your first step. If we disconnect and our visit disconnects, I will call you. Is this your number? Is this the right number to call? And make sure you have that documented in the notes. It could also mean that you say if the video goes down, go ahead and reconnect first. Try to reconnect. I'll give you 3 minutes to reconnect to the same way you connected before. After the 3 minutes, then I will give you a call if I don't see you. Right? That would be another way. But have that backup communication plan. Now, if you are a provider who works from home regularly and you don't want to give out a home number, which I would not blame you, and I don't recommend that you do, one alternative is to have kind of one of those throwaway phones that one of those throwaway cell phones that you would purchase from, Walgreens or whatever for just a few dollars. And that would be your backup call. So you don't use that on a regular basis, but you can give that patient that backup phone number. Just make sure it's charged. And so if things go down and I can't reach you or you can't reach me, here's the number that you could call or text. And you're just paying, buying the 60 minutes, and you probably will use it once a year. But it is one way to have a backup communication plan if you are at home and you don't want that patient calling your home number. All right, documentation. For those of you who are clinical providers or who are supporting the work of clinical providers, documentation is going to be the same for a telehealth visit plus. So if you are documenting and you have needs for a CPT code to be able to bill or an E&M code, all of that documentation remains the same and the requirements remain the same. So if there are certain things that you need to do to be able to document, a certain code, so you need to be able to take a patient's blood pressure, you can visually watch that patient and guide them through taking a blood pressure, or guide a caregiver in doing that, watch them on video so that they're doing it correctly, and you are then seeing what their readings are and documenting that. That is sufficient for documentation for a blood pressure reading. Always useful to, walk a patient through how you do a good blood pressure and then to lay eyes on that. But those are things that we can go through in a more clinically based training, but the documentation for that remains the same. So if you're required to have certain things, then do the same documentation. But on top of that, for a telehealth visit, we definitely encourage you. Some of this is not required, but it's recommended. Document the patient's location. That's again for risk management purposes. Patient was at home. Patient was at, Aunt Sally's house, who lives in Buckingham County, Virginia. Or patient was in, Uncle John's house in Tennessee, and I am a licensed Tennessee provider. Make sure that you are licensed if that is the case. Document your own location. So I'm in the office. I'm at home. I was taking this call in my car because the patient was having an emergency. That's where I was. It's always a good idea just to note that in the chart. The type of encounter and the technology used. If you don't have those things in your EMR as a field, just put it in the note. So video visit with patient using iPad, or video visit with laptop, or this was an audio visit using my phone. So document that, because some of that is going to impact whether you can get reimbursed or not reimbursed for that. And then there are many telehealth type of visits and virtual visits that are time-based for billing and coding. So if your technology doesn't automatically record when the visit started and when the visit stopped, then just jot it down. Started visit at 2:23 p.m., ended at 2:43 p.m. Because some of those time-based codes are going to be like for 20 minutes, you can build this code. For 30 minutes, you can build this code and you get a little bit more payment. And so if there's ever an audit, there's an audit trail. The reason for telehealth is an optional field. I don't think anyone requires it, but it's always a best practice just to jot it down. Patient contacted us for a telehealth visit, or patient wanted to come in, but there was 5 inches of snow and they didn't want to drive, and we did a telehealth visit. Or, by protocol, patient was asked to, initiate a telehealth visit before going to the emergency room. And so we did a telehealth visit, but it could just be a simple, phrase, just to document that. Some of that is just for your protection as well. First visit and verify annually. So I mentioned the consent. Consent is something that we like to say, do it annually and just document it in the records. So if you did a consent, in your first visit, a year later, you might want to say, hey, I just want to re-verify the consent information and then document it. And you could have changed your protocol using updated protocol dated, September 2024 instead of the November 2023, because your technology may have changed. Or some of your, you might be using new technology, or you might be using, now we have a text messaging system, and so we want to consent them for text messaging as well as technology. So that's why we say, kind of do that on a regular basis, at least annually. And then check your emergency and non-emergency numbers at least annually, because the patient may have moved and you have the wrong number documented in the chart. So that's another thing that you want to, check and document. And obviously, if you know that the patient's address has changed, then reconfirm their address and reconfirm the emergency and non-emergency numbers and put that in the patient record. All right, I'm not going to spend a whole lot of time on this because we're not going to have a ton of time. I already mentioned a couple of the laws and regulations. So obviously the licensures piece, but there are a ton of moving target laws and regulations right now, particularly related to Medicare, because we are still in the extension of the COVID-19 PHE emergency for many of the Medicare rules and regulations. So learning about those, learning about what may change between now and January 1st, learning about restrictions in terms of licensure, making sure if you are a clinician that your malpractice covers telehealth visits. I would say 98% of them do. Some of them require you to add a rider. Also, if you are licensed across state and you are wanting to see your patients by telehealth across state, make sure that your malpractice coverage covers across state. And make sure that the coverage caps are sufficient, because each state has different malpractice caps, and some states do not have malpractice caps at all. So then you really need to make sure that your insurance covers all of that. Another thing about laws and regulations is that there is some laws, and you all know this in terms of accessibility. So for patients who are with limited English proficiency, as well as patients with disabilities. And so really know and understand some of the guidance around telehealth visits for patients who have either limited English or who have disabilities. We do need to follow ADA telehealth considerations in terms of accessibility for patients. So for some of your patients, they may be deaf or hard of hearing. Some of them have mobility challenges. And so how do we create access for them? We do have some guidance documents on our website related to how to provide equitable access by telehealth for these patients. I'm not going to go through all of those right now, but those guidance documents do exist, and I can point you to those if you need them. Oftentimes, the patients who most need telehealth are the patients who have access challenges because they have disabilities. And so we want to make sure that whatever platform we use can accommodate patients who have some of these issues and challenges. So if you need that information, we can do a whole training on that as well. So etiquette is another piece of best practice, and I'm going to play a brief video for you. I think I enabled audio. If you don't hear the audio, let me know quickly and I will enable that.
Hello? Hello? Is anybody there?
Yeah, half the time he doesn't even know what we're talking about. I'm like, hello, what are we here for? You know?
Maybe you could do a chart.
Okay, so we'll get right back to your session, but I need to log into my computer. What the heck is the password? Ugh, this client drives me crazy. What an idiot.
So those are all kind of issues with etiquette. And we're so used to doing video and we're doing it from home and we're doing it for staff meetings and we're doing it with colleagues and we're used to being casual. We're used to having pets walk through. Sometimes that's not a bad thing. If you already have those established relationships, but usually we say be professional. Be professional in your dress, be professional in your background. If you're sitting in a messy room at home, go ahead and use a Zoom background. It's fine. Or some kind of background. If you need to, just pull a curtain over behind you or just put up a screen behind you so that you do look professional in your encounters. One of the things that we really say is simulate eye contact as best as you can. So look at the camera, make sure the camera is centered and it's not below you or way above you. If as much as you can, have that camera be at eye level or just slightly above your eye level so that when you're looking at the camera, the patient is actually seeing you eye to eye. There's nothing worse than the patient seeing the top of your head or, just your chin or not seeing your eyes at all. It communicates to the patient that you're not paying attention, or it communicates to the patient that you don't know what you're doing with a telehealth visit. Um, Lighting is also important. So make sure that they can actually see you. So in that kind of bad etiquette video, you have that silhouette. So that's usually what happens if you have really bad lighting and you're just showing up as kind of the ghost image. So check all of that. So this is what we recommend. Prepare your space and your technology before each visit. So give yourself that extra couple minutes. Remove background distractions. Turn off your cell phone. Make sure that your lighting is good. Do a test check. Make sure your sound is good. Test your mic. Make sure there's privacy. So put that do not disturb sign on your door if you're at home or even in your office, or lock your door if you can. Make sure that you are ready for that visit. So if you are accessing your electronic medical record and you're maybe using a dual monitor, have that electronic medical record up and to the screen that you want it to be at before your visit, so you're not busy scrambling for that. Again, test your system before every visit. Close your other applications so you're not distracted. I know that on my computer, I have little notifications that pop up at the bottom of my screen. And so I tend to go like this when I see a flash going on, and your patient's going to notice that. If you're looking down at your computer every time something flashes. So just turn off those applications, turn off your notifications during that time. Plan your scans and updates. So, if you're using something like Zoom or whatever, they have updates and they sometimes are quick, 30 seconds, 20 seconds, but sometimes they take a few minutes. And so you don't want that update happening, 10 seconds before your visit. So check all of that before your telehealth visit. Make yourself a checklist. If you are new to telehealth, it's a great idea just to create a checklist. On our website, which there's a link, we have actual sample checklists for telehealth visits. And so you can just kind of go through that, put that right by your computer and walk through that so that you are prepared and ready. One thing that we I really like in terms of this checklist is that narrate actions to the patient if you need to turn away and look away. Why do I say that? So let's say you are charting in your EMR and you're doing this. All right, the patient sees that you are not paying any attention to them, your head is turned. They have no idea because all they see is you probably from the shoulders up. All they see is that you're not paying any attention to them. They don't know what you're doing. You could be watching cat videos on YouTube. I mean, who knows? And so you might want to say, hey, I'm going to look away every now and then because I'm trying to take some notes. Some of the things that you're saying are really important. That to them gives them the information that they need. You know, I'm not just like texting my friend and planning my my next outing. I'm actually charting. I'm paying attention to what you're saying. So if I look down or look away from you for a few minutes, it's just that something you said was important. I wanted to remember it. I wanted to chart it down, put it in the notes. That's really all you have to say. And that will help with the communication and it'll help with your presence. All right, a few special considerations for education and training. So some of you may be doing telehealth education. You might be doing, let's say, nutrition education. It could be in a group setting. It could be an individual setting. But it's always good etiquette to let your participants know the protocol for asking questions. So if you're in a group setting, you might not want to be interrupted, or you might have, you know, a limited amount of time and you'll say, hey, I need to get through all my materials and we'll save questions to the end. That's great. Just say that up front. Or if you have a question, we would love for you to unmute, but go ahead and put your raised hand and show them how to do the raised hand because they might not know. Or you could say, you know, this is going to be informal. We're going to do this training, but I just want you, if you have questions at any time, unmute and ask your questions. So whatever your protocol is, let your participants know. Decide whether you want to have all your participants muted for that time. So you could say, hey, I'm going to mute everyone for now. If you want to unmute, raise your hand. Or you could just say, you know, if you have background noise, go ahead and mute yourself. But if you're in a private place, go ahead and keep yourself unmuted because we want to hear your comments and your laughter. Because that oftentimes helps kind of that flow and that kind of peer-to-peer conversation happen. We always say use real visual props when possible. So we can rely on PowerPoints, but there's nothing quite like, you know, if you're doing diabetes education and you can have a plate of food sitting on the table next to you and you hold up that plate of food and you say, you know, when you have a salad, this is what it might want to look like. Or when you want to add salad dressing to your salad, this is the amount that you should be adding. And you actually have that bottle of salad dressing and you point it to the camera. Now make sure you're facing the props to the camera, not yourself, so that the patient can see it. But it's always great to have those kinds of props because it's a great visual. It's a way to do things that oftentimes builds that kind of realism more than a PowerPoint picture would. Some other things, if you're using Zoom with slides, and if I were doing this and I didn't have embedded videos, which I do, I would consider doing this option. So you can use Zoom or you can use PowerPoint slides as your background. Zoom also has a setting on the display or the display options, and that would allow you to use video, but it keeps your head kind of in the picture. And so I felt it a little awkward to play a video with my head in it, like right on the side. But if you don't have videos, you can use Zoom as a background, or you can use your display options. To use Zoom, to use your slides as a background, when you open the share slides, you can do that advanced setting. So you can see that first screen with that red box. Go to the advanced setting, and then you can do PowerPoint as background. And then this picture is what you would look like. So you would actually literally have your head in the PowerPoint while you're talking, and you can change the slides as you're talking. The nice thing about this is it allows the person to be watching you and your slides at the same time instead of looking up and down to kind of see like where's the presenter at, which is what you're probably doing right now. I definitely recommend this if you're not using video. If you are using video, test it, see what it looks like. So if you are using video, you can't use the share PowerPoint as background, but you can use the share and then set your visual settings to have your image kind of either on the side or on the back. It does make the slide look a little bit smaller. So putting it all together, oops, this is a video that I want to show because it goes through telehealth etiquette and it walks through everything.
Aloha! The purpose of this video is to give you some basic tips about how to conduct a telehealth session using best practices. First, let's talk about your environment. What is behind you when you're on camera? It's best to have no doors and windows behind you, as they can be distracting for patients and could cause an interrupted session. A blank wall that is a neutral matte color works best. If you have any shelves visible, make sure they are not cluttered. You can always pull a screen or curtain across a door or wall to hide what's behind it. We want your surroundings to look professional. How is your lighting? Make sure what is seen on camera is well lit. No one wants to see a shadowy figure giving them information. Use extra table lights if necessary, since fluorescent overhead lights are not flattering. Try not to have a window or other light source directly behind you, as it will cause you to be backlit and make it difficult to see your face. How is your equipment set up? Just like an in-person visit, it's good to make as much eye contact as possible during a telehealth session. To simulate this, you may have to raise your laptop, tablet, or monitor with some books so that the webcam is positioned around eye level. Before each session, make sure that your face is relatively centered within the screen so that the patient is not just seeing the top half of your head. You may also want to use a noise-canceling headset if there might be any ambient noise around you. If there is a chance that someone might walk into your room while you are doing sessions, remember to put a sign on the door to not enter. Try to reduce sounds from others, including children, pets, cell phones, and other distractions, as much as possible. It's always good to look professional, especially on camera. Limit wearing patterns as they can be distracting. Don't wear noisy, big jewelry, and check to see if there is any glare off your glasses. Many people who do telehealth also wear a lab coat during appointments. Much like an in-person appointment, please do not drink or eat during sessions. If you are going to be using your mobile phone or a tablet, make sure you are not holding your device in your hand, as you will appear shaky to the patient. Do not move or walk around with your device to avoid having your head bob around. It's best to use a stand to make sure that you're stable within the video. Now, let's talk about patient interaction. Since most telehealth sessions are with people you have not met, make sure to introduce yourself and the purpose of the appointment. Some providers even put a sign on the wall behind them with their name. Then make sure to have the patient introduce themselves and tell you if there's anyone else in the room with them. Sometimes you can't see who else is off camera. Make sure the patient can see and hear you well. Ask them at the start of the session. Adjust the camera to maximize eye contact. Whether you're new at this, have done a lot of telehealth previously, or just logged out of this system an hour ago, before you start a new set of sessions, you should always test your connection to the platform. Make sure your internet connection, microphone, and video are working. It's better to troubleshoot before you're on with a patient than during a session. Ending the session. Remember to reiterate your recommendations to the patient and provide documentation for your records and the patient as needed. If you can, try to give the patient information about who to contact if they have additional questions. Finally, check that you have successfully logged out of the session completely. For more information, you can go to the
All right. So that kind of puts it all together, like what you need to do to really have good etiquette before, during, and after your session. So there are a couple things I want to leave some time for some Q&A, but I also recommend as a best practice that you train your clinicians. Each profession has different guidelines. So whether you're a dentist, a physician, a nurse practitioner, a mental health provider, there are professional guidelines for your profession regarding telehealth. So make sure that you understand what those guidelines are. Each state also has regulations that are by the professional boards. So you might want to make sure that you know what those are as well. There are all sorts of professional competencies. We have a ton of videos, but I would love to do a training with you on some of those as well at some point in the future. And these would be specific to clinicians. but it could be everything from the etiquette side for, a mental health provider, which has some differences than everyone else. The general things that we talked about today are all the same. But it could be also providing instructions for doing a self-directed physical exam. So obviously, if the patient's in your office, you're doing the physical exam. If the patient's at home, you're going to need to be a really masterful at helping the patient do what you would be doing by being your hands and feet. And so having that patient walk for you is one thing that you could check their gait, their posture. If they're complaining of abdominal pain, there are certain things that you can ask them to do to check the location of the pain. But there are also a bunch of videos on our website that kind of walk you through, how you do a neurological exam, how you would do an ENT exam, how you would do a skin exam. So those are all great things. If you're a physical therapist, there are ways to do a musculoskeletal exam as well. So this is my contact information, and probably 80 to 90% of the information that I provided today is actually available on our website, which is matrc.org. We have a whole section on telehealth best practices. We have a ton of videos, and that is going to be a great resource for you. But I am also available, and so I wanted to stop sharing my slides and just let you know about the Telehealth Resource Center. So I am actually a director of the Mid-Atlantic Telehealth Resource Center. We are one of the 12 regional and 2 national telehealth resource centers. We are federally funded by HRSA. So our services are entirely free of charge. And we do technical assistance and consultation around all things telehealth. And so if you ever have a question, whether it's a policy related question, a technology related question, which you have a great team already supporting that, or if it's just an etiquette or how do I do this kind of question, or how do I create a good protocol or consent form, those are things that we are available to help you with. And so please do not hesitate to reach out. And that is what I have for our training today.
Thank you, Kathy. That was excellent. We'd like to open that to any questions or thoughts about moving forward.
I have a question. How do you manage to monitor your quality of care if you're not recording any of the encounters?
Yeah, so one of that would be your clinician training. So making sure that they really understand how to use telehealth to its capacity. So, whether it's doing the physical exam. So the question I always ask is, how do you monitor your quality of care for an in-person exam? Because it really should not change how you monitor that, right? So you're really looking at patient outcomes. You're looking at whether you are meeting all of the standards of care for that patient. You're documenting all of the correct things. So your standard of care really should not change, whether it's a telehealth visit or an in-person visit. And I also say that there are some things that you can't do by a telehealth visit. But there are a lot of things that you can do that people don't think they can do by a telehealth visit. So I think that, it's really thinking through your standards of care, walking through how you can do that effectively by telehealth, and then making sure your clinicians are trained to do it in the effective way. Other questions or comments? The silence.
Excellent. Well, like I said, we've recorded this session to share with other employees who weren't able to make it, or to look back at it if anyone wishes. I think it's important that moving forward with MEOC, and part of my job really is to consider the specific uses that are proposed for telehealth, and really to customize the training and work with Kathy about customize the training based on clinicians, based on the specific use cases of telehealth that we're going to pursue, and based on the participant and members of MEOC. So part of kind of my job as liaison and going back and forth with Kathy, between Kathy and MEOC is to make sure that we deliver appropriate training and training that really does make sense in the context of your future use of telehealth. So I'll put my email in the chat. You're welcome to contact me at any time with questions afterwards. And I'll also send this recording out.
Thank you all. We are excited to get this going. We still only have 2 participants for PACE. We don't have a third one yet. We are looking to identify one. But so far we only have the 2.
Okay, that's good. I mean, I think that'll work, and we'll move along as you're ready and you know, our respective teams are ready. So we're excited and excited to continue with you all.
Thank you all. We are too.
Well, thank you everyone for attending. Kathy, thank you so much for the presentation today. That was great. And we really, we appreciate all of your time, taking time out of your busy schedule, especially in the context of 5 inches of snow in Southwest Virginia. So really appreciate it.
Thanks all.
Have a great Thanksgiving.
Thanksgiving.
Yep.
Thank you all.
Bye-bye.
You too.